Hey, welcome back to Not So Complicated, and today I'm presenting you a completely different form of content, and it is a song to remember tumor suppressor genes and oncogenes, since we all know that these two genes are being headache to us, right? So let's begin without further delay. So tumor suppressor genes, here is a song that you have, and the tune is Itsy Bitsy Spider's tune, right? So the song is APC, BRCA, TP53, RB, WIMS1, and FTSC, CDK and NP10, BHL and first main, DPC from SMART4 and lastly DCC, DPC from SMART4 and lastly DCC. That is how it is, right? So APC, BRCA, TP53, RB, WIMS1 and FTSC, CDK and NP10, BHL and first main, DPC from SMART4 and lastly DCC. That is how it's a bit spider. It may find you may find it tough to remember at first time, right? So but you have to practice it for at least a week, and it will be imprinted in your imprinted in your mind forever. So let's talk about these genes and mnemonics and memory aids, right? So APC, that is adenomatous polyposis coli. For example, every these genes you have to remember the full form of the genes, and it will be easier what neoplasia is associated to these genes. You have to remember like that, right? So APC is adenomatous polyposis coli, that is in colorectal carcinoma, and BRCA1, BRCA2. The initial BR is breast, and the further part CA is cancer. So breast cancer genes, that is breast, ovarian and prostate cancers, and CDKN2A, that is cyclin dependent kinase inhibitor in presence of in melanoma and pancreatic cancer, right? So and also in DCC there is deleted in colorectal cancer, the second two letters, right? CC, that is colorectal cancer obviously, and DPC4 SMART4 is deleted in pancreatic carcinoma, that is DPC, that PC is pancreatic carcinoma, and main one is multiple endocrine neoplasia, so it is affecting endocrine glands like pituitary, parathyroid and pancreas, that is PPP, 3P, right? You can remember like that. And NF1, that is neurofibromatosis type 1 and type 2. In type 1, the associated neoplasia are neurofibromas, optic glioma, and type 2 bilateral acoustic sonomas and meningiomas are affected. And P10 is phosphatase and tensine homolog, and they are actually found in Cowden syndrome and breast and thyroid cancers. And R for retino and B for blastoma, so retinoblastoma, and also in osteosarcoma. And TP53, that is tumor protein 53, are mutated in Lee-Frommeni syndrome, multiple cancers like breast, brain, leukemia, and then TSC1, TSC2, tuberous sclerosis complex, and hematomas as in hematomas and renal angiomyolipomas. And BHL is bone Hippel Lindau, that is B is bone, H is Hippel, and L is Lindau disease, and they are found in hemangioblastomas and renal cell carcinoma. WT1 is Wilms tumor, that is nephroblastoma. They are the tumors of children, right? So that is how we have completed our tumor suppressor genes. And now the oncogenes. The tune is Twinkle Twinkle Little Star. Okay, so let's sing. It is all great men to her to new, BCRable and Jack to Simic and Mick one, Sikit, KRAS, pancreas, lung, Biraphistic, BCL2, now I know my oncogenes too. That is how it is. Like I'm gonna repeat after me. That is all great men to her to new, BCR able and Jack to Simic and Mick L1, Sikit, Keras, pancreas, lung, Biraphistic, BCL2, now I know my oncogenes too. That is how we remember, right? So I have pointed out pancreas and lung in KRAS because it is obvious in adenocarcinoma of gastric disease. So gastric adenocarcinoma, colorectal adenocarcinoma, it is obvious that KRAS mutations are there, and that is how the song is. You can repeat it until you remember it in the tip of your tongue. So it just takes a week or so to remember these two. These are how we present. Let's talk about this genes here. ABL is avulsion leukemia virus, and it is found in chronic myelogenous leukemia cases, CML. And ALK is anaplastic lymphoma kinase, that is found in non-small cell lung cancer, anaplastic large cell lymphoma, and BCL2 is B cell lymphoma 2, B cell lymphoma, BCL, right? And they are found in follicular lymphoma, diffuse large B cell lymphoma, and BRAF is BRAF proto-oncogene found in melanoma and colorectal carcinoma, and EGFR, E is epidermal, G is growth, F is factor, R is receptor. So they are also found in non-small cell lung cancer and glioblastoma. And ERB2, that is ERBB2 or HER2 mutation, is in erythroblastic leukemia viral oncogene homolog 2, right? So that is found in breast gastric cancers, right? And FGFR3 is fibroblast growth factor receptor 3. They are found in bladder cancer and multiple myeloma. JAK2 is Janus kinase 2. Myeloproliferative neoplasms as in polycythemia vera and essential thrombocythemia. And KIT is kinase insert tyrosine. That is how we remember, and they are the most commonly found in gastrointestinal stromal tumors, that is GIST. And KRAS mutations are found in Kirsten rat sarcoma, right? They are, the full form of KRAS is Kirsten rat sarcoma, and they are found in colorectal, lung, and pancreatic cancers. That is how we complete our songs like this: Tumor Suppressor, Itsy Bitsy Spider Song, and Twinkle Twinkle Little Star. Thank you, and subscribe for more like Mnemonics, and also our study sessions of USMLE, like there is study sessions line to line first aid USMLE step 1 in there, and also clinical case discussions are we are doing that, and we are bringing a 4,000 plus questions ebook of clinical case discussions for less than $30, which would cost more than $600 in other platforms. So help us bring that. Thank you so much if you are still here.